The future of healthcare is an online platform and community for passionate healthcare professionals. Welcome to our new podcast that gives you valuable insights into tomorrow's healthcare. Enjoy today's episode.
Welcome to this new episode of the Future of Healthcare podcast. I'm here today with Dr. Edward Fitzgerald, who is clinical lead for care system redesign for KPMG Healthcare. Hi, Edward. We're really happy that you're here with us today. And thank you for sharing your thoughts about healthcare.
Well, thank you very much. It's a pleasure to join you today.
Thank you. So we can go ahead with the first question already. It's just a basic question on introducing yourself, your career and background.
Well, thank you very much. So my background is very deeply related to healthcare across a number of different aspects, which is perhaps a bit more unusual. I originally trained as a doctor, training in general surgery in the National Health Service and international health systems. And after 12 years of clinical practice, I was very fortunate to have the opportunity to step into a global healthcare role, really looking at the safety of the delivery of healthcare in low resource settings. And that was with the Lifebox charity founded by Professor Atul Gawande at Harvard. And it was a fascinating opportunity to actually look at practical frontline implementation of change in healthcare to try and strengthen healthcare systems in settings that really needed it the most. And it was a really eye-opening opportunity to see a side of healthcare delivery that many working in high resource settings and healthcare systems and hospitals just don't really ever get to see. And it really brought into sharp relief the fact that as a practicing doctor, often you are not necessarily the person who is best placed to improve systems and affect change, because that skill set isn't necessarily something that's given to you as part of your medical training. And so that really opened my eyes to that area and gave me a great interest, which I took forward. And in 2016, I stepped out of healthcare practice full time and joined KPMG. And over the last few years, I've been working both in the UK and internationally to help healthcare systems change their delivery, improve their strategy, and support them. And that's really been brought into a sharp relief this year with the level of support that's been required to help with the coronavirus pandemic.
Okay, thank you very much for this introduction. The second question was if you could tell us a bit more about your current job and what it implies.
So currently I work in a management consulting role, providing advisory support to healthcare providers and health systems. And that spans a very wide range of efforts right across strategy, policy and operations. One thing we find with many healthcare systems and providers is that the nature of healthcare means that you're obviously very focused on the urgent situations that you currently have in front of you. And the longer term planning is more complex and more time consuming, but particularly bringing in what best practices from outside of your system and outside of your provider organization is more challenging. Many people don't get the opportunity to see what best practice looks like around the world. So there is a real opportunity to help bring that and really share some of the learning from some of the leading organizations and health systems and try and really drive things forward. I think healthcare does tend by its very nature to be quite a traditional area of market and industry, and so being able to actually help drive it forward is a very rewarding opportunity.
Thank you. Yeah, I can imagine how rewarding it is, and thank you for explaining a little bit more about it. So I noticed that you're particularly concerned about today's healthcare system and you want to improve it. So, can you define what waste is in healthcare and what are the ways to meet this divide?
Waste in healthcare is a real problem. And when you look globally at the shortage in the healthcare workforce, if you look at the continually rising expenditure and costs associated with healthcare, there is a great need to address the levels of waste. And by that, what I really mean is the additional steps, the unnecessary utilization of resources, the inefficiency, the lower levels of productivity that you can quite often come across in healthcare through often just quite traditional and resource consuming operations. And there's a real opportunity to look closely at that and to try and take this back out. And there's many different ways of doing that. It's very widespread right across healthcare pathways and systems. And that could be looking at the skill mix that's required, ensuring that the people with the right skills are being used at the top of their license and being used across the roles that they are best able to do so. Looking at administration, what are the unnecessary steps? What are much leaner and more efficient ways of both organising the administration of healthcare, but also patient pathways themselves, and ensuring that that experience is maintained and improved for patients, while at the same time improving access and quality to care, but potentially all within inside that existing envelope by removing some of that existing waste.
And did you notice during COVID-19 that this waste increased, or did COVID-19 crisis made it more efficient?
Well, it's an interesting reflection, because COVID-19 is undoubtedly the most difficult challenge that healthcare has faced in many, many generations. And these challenges have obviously stretched healthcare systems and providers and the workforce really right up to the very edge. But within this, it has also provided a phenomenal opportunity for positive change. It's opened the door to actually reforming some of the long-standing traditional ways of working, of looking at new approaches, at looking at new ways of helping patients and helping systems provide the best healthcare that they can. And so it's a really interesting reflection that actually out of this crisis, I think, is being born a real opportunity to push healthcare forward and modernize it in ways that it's been quite difficult and slow to do so in recent decades.
Okay, yeah, so my next question was about how the COVID-19 pandemic impacted the healthcare industry, but I think that you already covered a small part of this question. I don't know if you wanted to add anything in general, or...
I think there will be a few long-lasting impacts from coronavirus on how healthcare is delivered going forward. I think the important reflection from me is that healthcare is simply not going to go back to how it was, and it would be wrong for people to think so. The biggest, most obvious change for me is the long overdue digitization of healthcare and shift towards digital health. And I think that will perhaps be one of the most prominent changes that we're going to see. And that's obviously been born out of some of the reality of coronavirus, of the risk of transmission, the need to keep people socially distanced and away from healthcare systems if that could be possibly avoided. So perhaps one of the most obvious changes that people are going to see going forward is around the rise of telehealth and digital consultations. But actually the changes will be much deeper than that right across health systems. And I think that's just one of several changes that we're going to see.
Okay, thank you. And I have a last question that is a bit more broad. So what do you imagine for the future of healthcare? I
think we're at a point in time now where people are going to take a long, hard look at how healthcare is delivered, how that is optimized, but also importantly, how it becomes more patient-centered. And I think there's a few threads in that. Often healthcare is delivered in a way that best suits the system, the provider, and the healthcare workforce individuals that are providing it. Less often is healthcare truly patient-centered. And I think that is a fundamental change that I really hope will be addressed in the future. And I think we now have, as I say, a much greater opportunity to address a few of these elements that are coming out of the back of coronavirus. I think reforming healthcare, as I mentioned, with a much more digitalized approach is now just a given, and that is going to very rapidly become the direction of travel, and we're already seeing that, and that trend is going to continue. I think one of the other important elements that I really have great hopes for the future is how both of those points then feed into the increased use of data, of healthcare data, as people start to realize its value and the opportunities that have not been previously explored. And many healthcare systems around the world are still reliant on paper and pen, but the ability to create a more patient-centered approach delivered through digital transformation and more digitally active means, and the data that can be driven off the back of that to help better define, increase productivity, generate efficiency, and make healthcare more patient-centered, it will be one of the other big changes for the future.
Okay, thank you. Yeah, I completely agree on the fact that digital transformation as well as patient centricity are kind of the keys to improve tomorrow's healthcare and are really important right now. And yeah, we have to work on it for sure. But thank you, Edward, for your interesting insights about the future of healthcare and for joining us today with this podcast. And yeah, I hope to hear you and talk to you soon to know about your future insight and your future point of view on healthcare. Thank you very much.
Thank you for the invitation. Great to speak with you.
Did you enjoy this podcast? Subscribe to our podcast channel or newsletter to receive the latest insights into tomorrow's healthcare.